The risk for prostate cancer is significantly higher for minority men. A 2022 study found black men are 64% more likely to develop prostate cancer than white men, and the mortality rate among them is nearly 2.5 times higher. That is startling. Right now, U.S. Secretary of Defense Lloyd Austin is being treated for complications tied to prostate cancer. His condition was revealed on Tuesday, more than a week after the Pentagon chief was rushed to the hospital. Joining us this morning is Dr. Bijoy Telivala, a medical oncologist with HCA Florida Memorial Hospital. First of all, thank you so much for coming on. This is a very, very important message, Doctor. First and foremost, could you walk us through some of the factors why black men are at a higher risk for prostate cancer?
Vic, that's an excellent question, and thank you for having me here. So we know statistically that African American and black men have a higher risk of developing prostate cancer. If you were to take around 100,000 men at the age of 70, 1,600 black men will develop prostate cancer compared to 1,000 white men. The reasons are multifactorial. Some of it is genetic. They have a higher incidence of certain mutations, including but not limited to BRCA. There's also a thought that they have less access to health care, so they are diagnosed at a later age and at a later stage, which makes it more problematic for them going forward. And also there's a concern that they don't have great access to health care, which makes it more challenging. So there's not one particular factor which makes it problematic. It's a culmination of multiple factors.
Right, many pieces to a complicated puzzle.
Absolutely.
And certainly that's why we're doing this interview, because we want to raise that awareness. We want to let people know, hey, get checked out, even if you're feeling okay, right? Is that the case? Do you see that people that are sometimes feeling okay still can develop prostate cancer without knowing it?
Absolutely correct. A lot of times prostate cancer does not have a lot of symptoms, especially if it is confined to the prostate. That's why seeing your doctor regularly, getting checked out, getting screened for prostate cancer is very important, especially if you are at a higher risk of developing prostate cancer.
Doctors always say early detection, early intervention. What does early intervention look like? What can people do to mitigate prostate cancer?
So let's briefly talk about the risk factors for prostate cancer. Prostate cancer is most common in the age between 65 to 75. More common, as we discussed, in African American men compared to Caucasian or Asian men. Alcohol and tobacco increases your risk. The one thing to know is that vitamin E, which is a vitamin which people take, can also increase your risk, especially if taken in higher amounts. The first step before doing anything is to get diagnosed. So as you said, we have to go see a doctor, get screened. But once you have a diagnosis, it becomes a multidisciplinary team approach because there are multiple options available. In some men, we do something called as active surveillance, where we can wait and watch. But the two main pillars of treatment are either surgery or radiation.
And is there a certain age when you should get checked?
So the guidelines vary. The guidelines from the Urological Association differs from what the other associations recommend. The screening guidelines, there has been some debate. Certain associations have recommended against screening, which has led to more people being diagnosed at a later stage. So this is an area of controversy where there's no firm guidelines at this time.
Let's go over it because it is so very important that we talk about this. If you could, give us the warning signs that people really need to say, okay, I've got to get screened. I've got to get to a doctor ASAP.
So just so that we are clear, screening means you don't have symptoms. When you don't have symptoms, the screening is usually more appropriate for men over the age of 50, people who have family history, African American men, and other risk factors. Symptoms of prostate cancer depend on where the cancer is. If it's only in the prostate, you could have blood in the urine, pain, difficulty urinating. If the cancer has spread to the rest of the body, it depends where it has spread. Usually it spreads to the spine first, and they complain of a lot of back pain, difficulty walking. If it has spread to the lungs, they have a bad cough. And if it's spread all over the body, they start losing a lot of weight.
Yeah, and certainly we know that there are a lot of complications that the Defense Secretary Lloyd Austin are dealing with right now. They don't want to go into too many details about that because he does have his private medical rights, but certainly something we want to keep an eye out. So thank you so much for coming on. We really hope that this interview inspires people to go out there, get checked, get healthy, and hopefully get treatment quickly if they are diagnosed.
Thank you very much, Vic, for having me here. I greatly appreciate it. Thank you.
Absolutely, and thanks for what you do in our community.
You're welcome.